You just took that glucose test or you're scheduled to take it. How do you know that you passed the glucose test once you're done finishing it? Today, I want to share what to expect after you take the glucose test so that you can move forward feeling more confident and prepared for your pregnancy. This information comes from my 25 years in labor and delivery, along with taking the glucose multiple times during my 3 pregnancies. So I really understand wanting to know what the results are right after you take it. Like, is it the ACT? Do you know that you bombed it right after you took the test?
All nurses to the nurses station.
Well, the bad news is you are going to feel the same either way. Everybody kind of feels like trash after they take this test, whether they passed the test or they did not. I felt like crap after both times of passing it and failing it. So how I felt really wasn't an indicator of if I passed. So the sad news is the only way to really know is to wait for your results. Now, some doctors vary in what they call passing or failing, but the results that they give you in your lab portal, because that's likely where you're going to get the results first, should be, fairly correct. I have seen some doctors who have kind of a tighter restriction or might recommend the 3-hour test a little bit before the lab would recommend it. So that's something to talk about with your provider. Now, if you're taking the gestational diabetes test, it means that you are looking at your 3rd trimester. I actually have a whole 3rd trimester checklist that you guys can download. I'm going to link it up above and down below for you guys so you can grab it. What these results are showing is just how your body responds when you get a large amount of simple sugar ingested into your body. Does your body kind of let that sugar hang out in the bloodstream, or does it pile on a lot of insulin to help bring it into the cells and use that sugar? That is what the test is testing for. I am here to say that I wish there was a better test for diabetes during pregnancy, but the A1C or just a simple fasting sugar is not going to be able to do it. If you're like, this test is not for me, I absolutely do not want to do it, talk with your provider. I know for me, they've actually told me that I am not allowed to take the test as a 3-hour test anymore. I'm only allowed to do it as a 2-hour test because my blood sugar goes so low. And we're going to talk more about that in a second, so keep watching. So what do the numbers mean when you get them back? Well, if you fail the 1-hour test, you will be encouraged to take the 3-hour test. And if you fail the 3-hour test, they will either give you a plan on how to eat and how to get a blood glucose machine, or they will send you to a dietitian. And honestly, I wish everyone was able to see a dietitian. If your provider is like, we'll just manage this ourselves, say, can I get a consult with a dietitian? I actually have a dietitian that I recommend. She actually teaches a chapter in the online prenatal class for couples on pregnancy nutrition. I'm going to put her stuff down below because she will do virtual consults, and I think that would be really helpful. And she's in most of the big insurance networks. And if you're loving tips like this during your pregnancy, it shows that you want to be more prepared and feel confident. I recommend a birth class so that couples can feel prepared before they go in for labor. I'm going to link the birth class that I recommend down below. So if you fail the 1-hour test, you'll be asked to take the 3-hour test. And it is just more intensive. It's more sugar and it is longer. You're going to get your blood sugar checked and then checked again 3 times. So it's similar to the 1-hour test, just 2 more hours of it. And I am here to tell you that on the 1 hour, this is important, but on the 3-hour, it is extra important that right after you get that last blood sugar taken, you eat a snack. Now, do not eat anything during the rest of the test. It will invalidate the results. You'll have to do it again. You're not there just to pass the test. You're there to find out if you have gestational diabetes. However, after that last sugar, getting a snack that has both protein and carbohydrates will set you up for success. Personally, I did not know that my blood sugar was going to drop into like a coma level range. Did not fall into a coma, but it was real low. So I like to take a sandwich that has a ton of peanut butter and some jelly or honey with it as well. A whole grain bread if we can manage that as well. And as soon as I get that 3rd and final blood test taken, I start eating that, and then I go pick up my kids and all the different things. But make sure that you're getting something to help sustain that blood sugar. The reality is most people are not going to feel so great at the rest of the day because that's not how we want it during pregnancy. We don't want to ingest large amounts of sugar. And this is if you're diabetic or not. You get that roller coaster off the other end and you just don't feel so good. So it's a real loser test. I wish it was different. Okay, so if you fail that 3-hour test and you are decided that you have diabetes, what is the rest of pregnancy going to look like? Well, first off, I'm here to tell you that if you control your blood sugars, it's going to look very much like a normal pregnancy. They will encourage you to take your blood sugars multiple times during the day. That will be part of your plan. But if you have those blood sugars well in control, I think not only are you actually going to feel so much better, I honestly think the diabetic diet is the way everyone should be eating during pregnancy, but also, you can likely go to 40 weeks. As long as your blood sugars remain in control, your pregnancy is going to look very similar. Now, if your blood sugars get out of whack, and that can happen for a variety of reasons. Maybe you are not eating the diet, and that's on you. Or sometimes they just get out of whack. You could be eating the diet absolutely perfect, but because of how your body is affected by the pregnancy hormones, it just does glucose in like the worst way possible. And I get this message so frequently on social media. I'm following the diet, but my blood sugars are just crazy. Just keep taking the sugars, be in contact with your provider. I would get a nutrition consultant as quickly as you can to see if they can help you out as well. Now, after birth, the baby will likely need to take blood sugars just to make sure that they're managing their blood sugar as well. They may have had some of those ups and downs of blood sugars during pregnancy, so they will need blood sugars taken after birth. As long as those are normal, then baby should be fine. It doesn't mean that they have diabetes. It's just making sure that they're managing their blood sugar because they may, again, have had more of those ups and downs than other babies. That being said, there are babies of moms who did not have diabetes during pregnancy that we also have to take blood sugars on. Sometimes they look a little bit shaky, sometimes they're a little bit bigger, sometimes they're a little bit smaller. So all of those babies need to have blood sugars. It's not just moms who have had diabetes who need to have their baby's sugars taken as well. They will likely encourage you to take a blood sugar test a few weeks after baby is born. A lot of my friends are encouraged to take a 2-hour version of this test. Some providers may let you just take the A1C. So talk with your provider about what is best for you, but they're going to want to make sure that this just wasn't diabetes that had never been caught before and that your body is returning to normal. Now, having gestational diabetes can be an indicator of what you are looking at in your future if you do not make any lifestyle changes. So if you end up with gestational diabetes, you're going to want to watch your diet and maybe follow the gestational diabetes diet that you've been following as you continue your life. It is a very healthy way to eat and a great reason to have another check-in with a dietitian maybe after baby is born as well. Now, the gestational diabetes diet is not a reason to stress out. I actually have a whole list of things that you should not be stressing out about. I'm going to link that one up above and down below. Thank you for joining us here at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth, and maybe even just these glucose checks.